That twitch in your eyelid that just won't quit, the Charlie horse that jolts you awake at 2 a.m., the heart palpitations that make you wonder if something's really going on, or maybe it's the anxiety that sits in your chest all day for no reason you can name. You went to your doctor, they ran blood work, they looked at the results, nodded and said, "Your magnesium is normal. Everything looks fine." And you just walked out of the office with the same symptoms, the same questions, and this quiet nagging feeling that you just got dismissed. But here's the thing. You weren't dismissed. The system just isn't set up to catch what's actually happening. Because that normal result, it's measuring the wrong thing. I'm Dr. Matt Mason. I'm a chiropractor, an acupuncturist, and a functional medicine practitioner. I spend my days helping people who have been told they're fine when they clearly aren't. And I want to show you why that normal magnesium number is so often misleading, and why it might be the very reason you're still struggling. So by the end of this video, you're going to understand the difference between magnesium in your blood and the magnesium that actually matters, the kind inside your cells. You'll know why the standard lab ranges missed the problem entirely. And more importantly, you'll have a clear, practical path forward. This isn't complicated, but it does require looking at the test differently. So let's start there. When most people hear that their magnesium is normal, they think it means the magnesium in their body is optimal. But that's a misunderstanding of what the blood test actually measures. So let's reframe the question. It's not, is my blood magnesium normal? The better question is the magnesium in my cells, where it actually matters, normal? And the answer for a huge number of people is no. Here's the physiology that makes this finally make sense. The magnesium in your blood, called serum magnesium, represents only about 1% of the total magnesium in your body. Think of your body like a house. The magnesium in your blood is the electricity flowing through the wires. It's important. You need it to keep the lights on, but it's not the main source. The rest of your magnesium, the other 99%, is stored in your bones, your muscles, and inside your cells. That's your cellular magnesium. That's the electrical grid powering the whole house. But when your doctor runs a standard blood test, they're only measuring the electricity in the wires. They're not checking the whole power plant, because your body is incredibly intelligent. It will do everything it can to keep that 1% magnesium in your blood stable. That tiny amount in the serum is tightly regulated for survival. It's necessary for basic functions like keeping your heart beating. If your diet is low in magnesium, your body will pull it from your bones and your cells to keep that blood level looking normal. This is called chronic latent magnesium deficit. You can be functionally deficient in your magnesium in your cells while your blood work comes back perfectly in the normal range. This is a massive blind spot in conventional testing. It's a system failure, not a failure of your doctor. They are following standard guidelines based on standard tests, but that test is missing the whole picture. One of the core reasons for this confusion is there's no single accepted normal range for serum magnesium. A 2022 paper showed that hospitals and labs around the world use wildly different cutoffs for what's considered normal. So this means you can be told you're normal by one lab, but deficient by another. And these ranges are often based on a population that may unknowingly include people who are already deficient. So the reference range itself is built on a flawed foundation. Now that we understand why the test is flawed, let's talk about what happens when your body's magnesium is low. This is where symptoms I mentioned at the start come into play. Magnesium is a cofactor for over 300 different enzyme reactions in the body. It's like the key that unlocks the door for energy production, muscle function, nerve signaling, and so much more. When your body is short on that cellular magnesium, things start to go wrong. You might get those muscle cramps and twitches because magnesium is essential for muscle relaxation. Without it, your muscles are more likely to stay contracted and spasm. That's why it's so closely linked to restless legs, Charlie horses, and even eyelid twitching. Magnesium also helps regulate how your nervous system processes pain signals. which is why low levels are often linked to chronic pain conditions. Your heart is a muscle, and it relies heavily on magnesium to maintain a steady, normal rhythm. Palpitations, a racing heart, or that feeling of a skipped beat can be a sign that the heart's electrical system isn't getting enough magnesium it needs. And what about your mood? Feeling more anxious, irritable, or depressed can be connected to low magnesium. It plays a role in the function of your nervous system, and it helps regulate the stress response and a calming neurotransmitter called GABA. So if you're deficient, you're more likely to feel wired, stressed, and unable to unwind. Here's something else to consider. Many people are taking medications that actively deplete magnesium. Proton pump inhibitors for acid reflux, diuretics for blood pressure, and even certain antibiotics can cause magnesium loss over time. So if you're on one of these and you're experiencing these symptoms, that connection is worth exploring with your prescriber. Don't stop any medication without medical supervision, but do ask about alternatives or whether magnesium testing and supplementation might be appropriate for you. Now, I want to pause here. We've covered a lot. We know the test is flawed. We know the symptoms are real. We know why they happen. The big question now is, what can you actually do about it? I want to give you a practical, natural, and evidence-informed approach. There's a hierarchy I want you to follow. First, remove obstacles to healing. Then, support your terrain through food and lifestyle. Then, and only then, consider targeted supplements. Let's start with the obstacles. Your body can't use magnesium effectively if something is in the way, and there are several common things that might be blocking you. First, chronic stress. When you're stressed, your body releases cortisol and adrenaline, which increases your need for magnesium and also makes your kidneys excrete more of it. So if you're constantly in fight or flight mode, you're essentially flushing magnesium down the drain. This is why stress reduction isn't just about feeling better, it's a physiological necessity for restoring your mineral balance. Even 5 minutes of deep breathing or a short walk outside can begin to shift your nervous system out of the stressed state. Second, consider what you're drinking. Alcohol is a known magnesium depleter. It increases urinary excretion and interferes with absorption. So if you're having a few drinks most nights, that could be a significant roadblock. Also, high caffeine intake can increase magnesium loss. So if you're relying on coffee to get you through the day, you might be creating a cycle where caffeine drains the magnesium you need to actually feel calm and energized. Third, and this is one many people don't even think about, is digestive health. If you have digestive issues like acid reflux, bloating, or irritable bowel syndrome, you may not be absorbing magnesium efficiently, even if you're eating it. This is especially true if you're taking acid-blocking medications, which reduce stomach acid needed to break down and absorb minerals. So working on your gut health through fermented foods, prebiotic fibers, and digestive support can make a huge difference in how well you absorb any nutrient. Now let's talk about sleep. Sleep and magnesium have a bidirectional relationship. Magnesium helps you sleep by calming your nervous system and supporting GABA, the neurotransmitter that helps your brain unwind. But poor sleep also increases stress hormone production, which depletes magnesium. So it's a vicious cycle. So prioritizing good sleep hygiene, things like consistent bedtimes, reducing blue light exposure in the evening, and keeping your bedroom cool and dark sets the stage for your body to actually use magnesium effectively. Next, the food. The best place to start is with what's on your plate. The best natural sources are green leafy vegetables because magnesium is actually at the center of the chlorophyll molecule. So think kale, collard greens, and Swiss chard. Other excellent sources include nuts and seeds like pumpkin seeds and almonds, as well as beans, lentils, and certain fish. So focus on adding these to your plate at every meal. But here's a practical tip that many people miss. Soaking beans, nuts, and grains before eating them. Phytic acid in these foods can bind magnesium and reduce your absorption. So if you soak them overnight and rinse them before cooking, you significantly reduce the phytic acid content and unlock more of the magnesium for your body to use. And consider how you're eating. Eating a large meal high in carbohydrates can stimulate insulin release, which can shift your magnesium from your blood into your cells temporarily. But if you have insulin resistance, your cells may not efficiently use that magnesium. So pairing your magnesium-rich foods with a source of healthy fat or protein can help stabilize your blood sugar and improve overall mineral utilization. Now you might be thinking, I eat a healthy diet, Dr. Mason. Why can't I just get all the magnesium I need from food? And that's a fair question. The unfortunate reality is that modern farming practices have depleted our soil of many minerals, so even healthy foods might not have the magnesium content they once had. So in many cases, food alone is not enough to restore your body's stores, especially if you've been deficient for a long time. This is where targeted natural supplementation can be a game changer. But here's the clinical pearl I want you to remember. Not all magnesium is created equal. The form you choose matters enormously, and it should match your specific symptoms. If your primary complaint is muscle cramps, you want a form that's well absorbed and good for muscle tissue, like magnesium glycinate. The glycine component also has calming effects on the nervous system, so it's a good choice for evening use. It's gentle on the stomach and generally well tolerated. If you're dealing with anxiety, sleep issues, or any neurological symptoms like brain fog or mood problems, magnesium threonate is a fantastic option because it's one of the few forms that can cross the blood-brain barrier effectively. This means it directly supports brain function and neurotransmitter balance. So I often recommend this to patients at bedtime for its calming effects. Now, if you struggle with constipation, magnesium citrate can be helpful because it draws water into the bowels. But be cautious with higher doses because it could be too effective for some people, and you'd want to avoid loose stools. So start low and increase gradually. And a good all-around option that's affordable and effective for many is magnesium malate, which is often helpful for energy and muscle pain. The malic acid component plays a role in the Krebs cycle, which is how your cells produce energy. So this form can be especially beneficial if you're dealing with fatigue. A quick word on dosing. It's generally best to start with a lower dose, say 100 to 200 milligrams, and increase gradually as your body adjusts. So splitting your dose throughout the day can improve absorption and reduce the risk of digestive upset. And I recommend taking magnesium with food to minimize any stomach irritation. For most people, a total daily dose between 300 and 400 milligrams from supplementation is a reasonable target. But individual needs vary, so pay attention to your body's response. So if you have kidney disease or heart conditions, talk to your doctor before starting any new supplement. So how do you know if what you're doing is working? That leads us to the real conversation about testing. If a standard serum test is so unreliable, what's the point? If you want a more accurate picture of what's happening inside your cells, you need a red blood cell magnesium test. This measures the magnesium inside your red blood cells, which more closely reflects the magnesium in your tissues. It's a much better indicator of your long-term status. So from a functional medicine perspective, we typically look for an RBC magnesium level between 6 and 6.8 milligrams per deciliter, which is higher than the typical lab reference range that just says normal. You could ask your doctor for this test, or you could work with a functional medicine practitioner who is familiar with it. But here's a key point I want to leave you with. For most people, the test is the symptoms. If you have the symptoms we talked about, the muscle cramps, the palpitations, the anxiety, and you try the strategies we've discussed and they go away, you have essentially answered your own question for yourself. Your body is telling you what it needs. That's the innate intelligence at work. So before we wrap up, I want to give you one more practical insight. When you start supplementing, don't expect overnight results. It can take several weeks to months to restore your cellular magnesium stores. Be patient with your body and consistent with your approach. If you experience loose stools, you're likely taking too much or a form like citrate or oxide. So switch to glycinate or threonate instead. And if you're looking for high-quality practitioner-recommended magnesium supplements, I've partnered with a company called Designs for Health. I've placed a link below to my dispensary where you can find the specific forms I mentioned today, along with dosing guidance. But always remember that supplements are just one piece of the puzzle. They work best when combined with good food, good sleep, and stress management. So let's bring this all together. Here's the core takeaway. The standard magnesium test is a tool, but it's a blunt one. Your symptoms are the much more accurate guide. If you feel tense, crampy, anxious, or fatigued, don't let a single number on a lab report convince you that you're fine. Your body is speaking to you through those symptoms. It's showing you its innate intelligence. It's trying to tell you something's off. My goal is to help you understand and support that wisdom. Your first step today is simple. Pick one thing. Maybe it's adding a serving of leafy greens to your lunch. Maybe it's trying magnesium glycinate supplement before bed. Maybe it's just making sure you're getting to bed at a convenient time. So just start with one tangible step to support your body. You don't need to do everything at once. So if you're interested in how your daily diet might be affecting your mineral levels and overall health in other ways, I will be covering that next, and I think you'll find it very helpful. Thanks so much for watching. I'd love to hear how things go for you in the comments. And if you found this helpful, please consider subscribing to the channel. I'll see you in the next video.